Hello and welcome to this video series on scientific developments that have been driven by war. Unfortunately, part 1 of this series has been held up by a YouTube copyright claim due to its algorithm. This should be resolved soon. Part 2 of this series will look at developments prior to the turn of the 19th century. The first major developments came during the Crimean War of 1853 to 1856. To drastically simplify it, the war was fought between Russia, the other Western powers, and the Ottoman Empire. It was initiated by religious conflict, political shenanigans, and failed diplomacy. Ultimately, the Ottoman Empire declared war on Russia with the support of the British and French. After initial incompetency, the war became focused around the naval base of Sevastopol. It is the siege of this naval base and the surrounding city that gave rise to a similar horror show to that of World War I. It is estimated that Russia lost over 530,000 combatants, and the belligerents lost over 223,000. Focusing on the British losses initially, the winter of 1854 to 1855 was unusually harsh, and no one was prepared for it. This led to mass casualties from combat and environmental conditions. Like World War I, that produced casualties of an unprecedented scale for the time, the Crimean War produced unprecedented casualties for the 19th century. This is where Florence Nightingale comes in. She is famous as the founder of modern nursing. The Crimean War became her central focus. When reports came back to Britain about the conditions for the wounded, in October of 1854, she and 38 staff, who were volunteers, went to the Crimean War theatre to be nurses. They arrived in early November 1854 in Scutari. This is part of Istanbul. She found that the poor care for the wounded soldiers was being delivered by staff that could not provide it due to an excessive workload. This was compounded by the indifference of the officials involved. There was a lack of medicine, hygiene, and infection was rampant, which led to a very high fatality rate. After being unsuccessful in trying to resolve issues on site, Nightingale asked the Times for a government solution to these conditions, and the government responded by seeking the design of a prefabricated hospital that could be built in their home country and then deployed to the Dardanelles. This resulted in the Renkioi Hospital, a facility that had a death rate 10% that of Scutari. There are arguments made that Nightingale's actions reduced the death rate from 42% to 2%. This was through improvements in hygiene, calling for the Sanitary Commission, and implementing a number of other factors such as hand washing. During the first year at Scutari, just over 4,000 soldiers died there. It's a tenfold increase, dying of diseases that were avoidable than from battle wounds. This was further affected by the overcrowding, defective sewer systems, lack of ventilation, and the incompetency and disaffection of the Sanitary Commission. 5 years after this, you have the American Civil War, which ran from 1861 to 1865. While seen as barbaric and backwards, the medical advances of the Civil War should not be underestimated. The military, political, and philanthropic minds of the time put themselves against the problems faced by soldiers. Soldiers died from 2 general causes: battlefield injuries and disease. The first was a purely military matter, but it fed the latter. The wounded were evacuated from the battlefield and were then treated, often with deleterious results. Twice as many soldiers died of disease during the war than in combat. The war left about 1 in 10 able-bodied Union soldiers dead or incapacitated, whereas it was 1 in 4 for the Confederate Army. And there was a lack of antisepsis or asepsis. There were no antibiotics. An amputation of shattered limbs was the most common treatment given to injured soldiers. It was carried out on a mass scale, under conditions that would to the modern eye seem horrific, but at the time were cutting edge. The first major development out of the Civil War was the use of quinine for the prevention of malaria. Large-scale use of quinine as a malaria prophylaxis started around 1850, and it was very frequent. 224 out of every 1,000 Union soldiers were seeking medical treatment for it. It was particularly common in southern states such as Arkansas and Mississippi. It was discovered in 1861 that quinine could be used prophylactically to prevent malaria in these southern states. Unfortunately, the Confederates did not have access to a large enough supply for it to be used this way, but the Union Army did have access to such, and did use it as a prophylaxis. There were also diseases that could not be treated. An example of this is yellow fever, which was largely eliminated by the use of quarantine. As an example, in North Carolina, Piedmont served as a haven for Confederate refugees. They fled the war to the relative safety of the southern interior. They came from a number of states and eventually found their way into one central location. By 1862, the number of these refugees had caused a significant problem with overcrowding. In August of 1862, a yellow fever outbreak in Wilmington created a significant issue. Yellow fever is communicated by bodily fluids, and more regularly using mosquitoes as a vector. If you survived yellow fever, you had a lifelong immunity, but there was a problem with this. The chances of survival with yellow fever are not good. If you develop severe symptoms, there is about a 1 in 3 chance of dying. The administrators and government of the time understood this fact, and they went to great lengths to try and control its spread. This was generally by quarantine. Yellow fever was often preluded by the arrival of a ship from a Caribbean port. Ships that arrived at this point were often quarantined for up to 40 days. One example of this involves Jonathan M. Fultz. They were given instructions that they would be paid $1,000 per month if there were no outbreaks of yellow fever under their watch, but the moment it occurred, they would cease receiving any payment. This process of quarantine eventually led to the virtual elimination of yellow fever. Going back to the hospitals, gangrene was an issue, and the Civil War found certain ways to treat it. One of the more common was a combination of bromine and isolation. Hospital gangrene is a type of necrotizing fasciitis that is seen in larger hospitals. It's generally thought to be a consequence of infection with streptococcal bacteria. The nurses taking care of patients would occasionally develop erysipelas, further evidence of a streptococcal infection. A staggering percentage of patients with necrotizing fasciitis died with this during the Civil War. All up, it was about 45%. The best practice at the time was to dissect away dead tissue and inject the wound with bromine under anesthesia. It was then packed with bromine-soaked dressings, and the patients were isolated. Overall, this led to a reduction in the number of patients dying from it. This was helped by further procedural adaptations which involved the nurses dressing the patient's wounds last and washing their hands in chlorinated soda. There is an image of the Civil War, and in particular of amputations, where soldiers in the operating theatre are flailing about in what appears to be agony. However, this is a false impression. The Civil War was one of the first large-scale uses, and more appropriately, safe uses of anesthetic. Anesthesia was used in 95% of Civil War surgeries. By the 1860s, the qualities of anesthesia, and in particular chloroform and ether, were well known and they were widely used. Chloroform was the preferred anesthetic, as a smaller amount was needed and the effects were more rapid. Surgical anesthesia had been available for 15 years prior and extensively applied. By the end of the conflict, it was universally used, with more than 80,000 known instances of anesthetic being given. Considering how often anesthesia is used, even in mild surgical operations today, you can see how this is incredibly relevant. You then have the performance of more advanced surgery that became available as a consequence of anesthesia and the necessity of war. In particular, neurosurgery was birthed by the Civil War. As with the First World War, the Civil War marked a major turning point in the nature and type of injury soldiers would receive. In this period, gunshot wounds outnumbered puncture wounds from a bayonet or sword. The crude nature of the injuries brought about by the weapons of the war created issues specific to it. This is seen in the multi-volume medical and surgical history of the War of the Rebellion, which was published following the Civil War. It contained details of 983 brain injuries, the largest case study ever. This work also detailed the activities involved in 911 operations for non-superficial head injuries. The overall mortality rate for these was 45%. There was also a 57% mortality rate for open brain surgery. Then there was damage to the spinal cord and similar structures from bullet wounds in the time that had to be dealt with in a similar manner. This means neurosurgery of one or more kinds was no longer rare during the Civil War. The work done there is occasionally referenced even today. Finally, techniques were developed for arterial ligation. Arteries are the primary way of losing blood when wounded. They are a pressurized part of the vascular system, which will force blood out. Ligated arteries prevent this blood loss. The Civil War led to an explosion of knowledge in this area. The reason for this is that early surgical techniques could not control blood loss, called hemorrhaging. That results from cutting healthy arteries. Cutting these would lead to blood loss, increased risk of infection, and death. Surgeons at the time recognized this fact and began developing techniques to mitigate blood loss. From this began the early development of arterial ligation techniques that are used today in surgery. The 19th century is seen as being a long time back, with little of value now. This is the same time that bloodletting and leeching was still a common practice, although waning in popularity. The developments in medical and surgical techniques at the time brought about massive improvement in the care to soldiers, and many of these are still relevant today. Prefabricated hospitals are often deployed to battle zones by any competent military. Quinine-derived products are still used to treat malaria, and quarantine is a common feature at most national borders, whether for animals or humans. Hospital gangrene is a recurring issue now, and things like bromine may make a reappearance as ways to treat it. And then you have anesthesia. It's used almost universally in surgery today. Whilst the neurosurgical techniques of the Civil War are seen as very primitive now, for the time, they were cutting edge. And looking at what we have achieved now from this, you would be amazed. And finally, arterial ligation. When you consider the amount of surgery done and the complexity of it nowadays, Arterial ligation is only a small element, but it is an important one. Thank you for watching this video. If you have found it interesting or useful, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.